Hi, I'm Amy, a physical therapist here at OakLeaf Surgical Hospital. Today we are going to give you some information related to your upcoming shoulder surgery. The information we are going to give you is based on general practices from the day of your surgery until about 2 weeks out. That can fluctuate a little bit with when you see your surgeon for follow-up and when you start physical therapy. In the video, you will notice there are 2 sling options. Those are picked by your surgeon for your surgery. Please note the difference in how they appear so that when you are home, you can make your adjustments and use your sling accordingly. We also will have information on the ice unit that you will go home with. We will reference the exercises that will be in the handout that you will take home. We will go through a brief dressing with a zippered long sleeve, and we'll review different positioning, comfort techniques, and adjustment of the sling. This video is a great resource for you to come back to with your family or friends once you are home. If you have any questions, don't hesitate to reach out to your physician, a nurse here at OakLeaf, a physical therapist, or someone involved in your outpatient rehab. We are going to give you some instructions on how to get in and out of your sling, how to do your exercises, how to get dressed, and how to use the ice pack. So your sling is on. It looks like it's fitting you pretty good, but let's go through some of the highlights on how to use this sling to fit you the best. So a couple different things. As we move through here, each of these Velcro tabs or buckles, we want to operate kind of one at a time. If you start to do them all, they get jumbled, you forget where they go. So we just want to go one at a time. So as we move through this session here, we're going to do a little bit of exercise with our end goal of being out of the sling. Then we are going to put that long sleeve on that you brought with you. And then we're going to put your sling back on and talk a little bit about the ice. So let's start with some of the straps here. So this strap here is one that goes just under your thumb. And we want it to be there so that it protects you from sliding around at night or avoiding reaching for anything when you're out in the community or at home. When I take that one off, I just tuck it back behind you. Okay. Now you'll see that your hand is free. I encourage you to move those fingers. So some gentle gripping. You don't want to squeeze too hard. This isn't a muscle power thing, but we're trying to get some of the fluid out of your fingers. We want to make sure the blood flow is working. Yeah, you can kind of do the wiggles. You also can do a little bit of wrist motion. If you tolerate, some people do just a little bit of kind of the palm up, palm down. You won't be able to just go into full palm up, palm down. That's not going to feel good on your shoulder, but do know you can do a little bit of it, which helps you work out some of that stiffness in your elbow. You will see on this particular sling, there is a black ball attached, and it kind of comes in its own little holster here. It comes out of here, and it can be placed in your hand for some gentle grip and release. I encourage you to do 10 to 20 repetitions of this as often as you think about during the day. Again, you can roll it around, you can squeeze it. It might actually start to feel good because you can actually do something with your arm, and just either keep it with your sling or keep it on the table by your favorite chair somewhere so you're reminded to do this pretty frequently during the day. As the days and weeks go on, you won't need as much time with the ball, but for right now, it's going to be pretty important. So we're just going to put it back in its little holster here. And then we can put it right back on your sling where it started. When you are in the sling, I would encourage you not to grip that while you rest. Let it be separate from the sling and just let your wrist hang there, okay? The next movement is going to be actually for the elbow. We're going to work on taking your arm out of the sling, letting your elbow straighten, and let your hand drop down towards the floor. So to do that, we're going to take off this long piece of Velcro. And again, I'm going to tuck it out of the way. And then we have this short little piece that goes through this loop right here. We're going to take that, put that back where we found it, and that opens up the sling. Now, when I pull this sling away, stay nice and relaxed. Try not to tense up your shoulder. It might be a little tight in your elbow, but just let that stiffness work its way out. Okay. So we're going to start here, fold this back, and then just drop that hand down towards the floor. And for a lot of people, they get to the point where this actually feels good to do. Yeah, right. You are in this sling all day. You only come out of it for this exercise and one other, and then showering and dressing. Mm-hmm. So taking advantage of this opportunity to be able to let that arm hang down is important. On the handout that you will get to go home with you today, you will notice that there is a movement where it's a little bit of some elbow bending. Now, either a family member can help you with this, or your good arm could reach over and kind of grab by the thumb, by the hand, there you go, and bring it up at the elbow. We don't need to come way up into full elbow bend. And then as you come down, you can let gravity be your friend. Go ahead and let go. Let that elbow straighten out. You will get to the point where you can do some of this on your own, but we don't want it to be forceful. We don't want it to be something that you're pushing through a certain level of pain. You're going to have some stiffness. You're going to have a little discomfort. But in general, we're focusing on getting this elbow straight and then doing the bending as tolerated. Okay? Okay. From here, one additional exercise, I'm going to have you stand up with me. We are going to do a pendulum exercise. A pendulum exercise is going to be you leaning on something sturdy, bending over at the waist, and letting this arm drop down like a pendulum on a clock. Mm-hmm. So let's use the bed rail there. So just lean on that bed rail, bend over, and let this arm come down and away from your body. You want to think about it being heavy, like you got a gallon of milk hanging from that arm, and just let it dangle. This is the very start of being able to get that arm away from your body so that when you get to outpatient therapy, this doesn't seem like such a foreign thing. Mm-hmm. Now, as you feel better over the next couple days, you can start some movement where you're actually doing just a little bit of like an active pendulum. Yep. You want it to come from your legs, not from your arm. Yep. So you might have to reshift yourself. There you go. The most important thing is that the arm dangles. If you're like, I am not coordinated enough to do this, don't worry about it. Now, if we stand back up, you'll notice that your arm is just going to kind of come right back up into your sling. So have you back up back to the bed there and sit down. So we can go ahead and slide that elbow back. Yep. And now we are going to refasten the tabs we use to open this sling up. So Velcro there, Velcro here. And if you were all finished with exercises, whatever you're doing at the moment, this tab then comes back across gently under your thumb and fastens there. It does not need to be tight at your thumb. You want it to feel like it's keeping your arm in place, but it certainly shouldn't be something that's starting to cut into your thumb. So now I want to go through, now that we did those exercises, I want to go through and we'll get that long sleeve on that you brought with. So we're going to take the sling off, but we're going to kind of go through the same process of the same tabs, the same movements. So just to repeat here, we are taking this one off. We are taking the one across the forearm off, and then we are opening up the one at the top. That will then allow you to get that arm into that elbow straight position and just let it dangle. Now, to get this thing off, there are two buckles. There's one here at the waist. We can just kind of push to the side, and then we have the one across the chest. This strap comes off like a backpack. So if you've got good motion on that arm, you can slide that one out. Now, you're going to hold your arm still. I'm just going to take the sling. I'm going to kind of just push it back behind you. And you've kind of got the mattress here to use as a little bit of support. Now, without that pillow there, you're going to feel possibly, it's a little tight, or maybe it pulls a little bit. But just know you're not damaging anything. It's more just to transition out of that sling. So I'm going to let the sling sit behind you. I'm going to grab that long sleeve. So when you are working with anything with sleeves, even when we put this t-shirt on a little bit earlier, you've got to do that sore arm first. So I typically kind of gather up my sleeve. I want to come down to where your hand is, and I'm going to guide your hand into that cuff. Yep. And then you are going to need some help probably at first with this. A couple weeks, you'll be doing this a little bit easier. Or you reach up or reach forward. There we go. Push that one through. And then you can kind of fine tune and figure out where you want to be here.
Get comfortable.
Yes, exactly. Okay. So for any long sleeve, that's going to be the easiest. Now, if it was a t-shirt, like we did earlier, reminder, you do the sleeve over your head and then your other shoulder. Just don't reach with this arm. No forward motion, no out to the side motion, no kind of wiggling it in there. You want this to kind of be the dead arm so that we're not challenging any of that surgical repair. So then I'm going to grab the sling for you here so that you can take a look at what this looks like from all sides. So we've got the actual sling. We've got the pillow that was up against your body. We've got a strap that goes around your waist. And then we've got the strap, that backpack strap that goes up over your other shoulder. Putting the sling on is going to be a little easier if you come from behind and underneath. So if I gently help lift this arm out to the side, as minimally as I need to lift it, and I bring it up to about the height of your elbow, that is a good place to start. I like to get the waist strap in place. That clicks right in the front. I like to do the backpack strap next. So there is an in and an out, so you want the straps on the outside. There you go. Yep. Okay. This one then gets a little snug at first because we got to bring it across your body here, but we'll readjust it here in a minute. We bend at the elbow to bring your arm up and get that forearm into the sling. And now we go through that process of refastening all the Velcro pieces here. So we got this one here.
Okay.
Yep, kind of comes across in a nice straight line. And then we've got that one, lost my ball there, under the thumb there. Now go ahead and just slide that arm back a little bit. Yep. And then we could fine tune anything. So if we needed to make the waist a little snugger, there's Velcro adjustment there. If we need to take up any slack here, we have options here to be able to tighten things up, loosen things. This is based on comfort. There is not a, you must be right here. You want to be about 90 degrees, which you are. You want to be somewhere in between, not all the way forward and not all the way back. And you want to be able to relax your shoulder and have these straps do the work for you. Okay, fit pretty well? Feel pretty good? Good. All right, we're going to teach you a few things about this particular sling to make it a little bit more comfortable for you. So the sling itself is pretty straightforward. There's no other buttons or Velcros. There's just this clip right here. So if we need to do some adjusting on the sling for your comfort, one thing to keep in mind first is that you want part of your hand to be supported by the end of the sling. I don't want your wrist dangling down where you could get some increased forearm soreness or even some wrist joint soreness. Where you are now is not a bad spot to be, but if you slide your elbow back a little bit, you can get even just a little more tucked in there. This could be especially helpful if you're out in the community, walking around while you're sleeping at night. The other piece of adjustment is going to come from this strap here. So the strap in the front has Velcro and gives us the ability to be able to go up or down. Now, if we go a little bit up, you can start to feel maybe a little more support at your elbow, but you also can start to feel some increased tension at your neck. I don't necessarily want to increase the tension at your neck, so you might need to back it off just a little bit and fasten it right there. If you are feeling like the back of the sling the fabric in the back or the elbow isn't supported, there is a slide adjustment here, like a belt or like a purse strap, that you could make longer or shorter. You're in a pretty good spot now, but if you put on a bulkier shirt, you're moving around a little bit, it loosens while you're sleeping at night, you may need to just slide that up or down back there. Otherwise, the sling needs to be on at all times. It doesn't come off until your surgeon or your therapist tell you otherwise. It does come off for showering and dressing, and just do your best to make yourself as comfortable as possible. Couple tips for you as you get home. If you are sitting somewhere like a couch where you don't maybe have an armrest, using a pillow under that arm can help offset some of that weight. You might need to add another level to that pillow, or maybe a blanket on top, so that you can just feel the shoulder on weight and then also feel like you got a little slack on that strap. If you pull the pillow out, if you are sitting on a couch with armrests or a recliner with armrests, having that underneath there could help too. Any sort of support to help you feel a little more comfortable when you're feeling a little irritated in the muscles could be helpful. So this ice pack you have to take home with you. This will be connected to a large box that has the cooling water in it. So it's ice cubes and water, plugs into electricity to run the pump, to then be able to put this ice pack on your shoulder. I do want at least one layer of cloth in between the ice pack and your skin. As you lay it there, we have different length Velcro straps to be able to go from the back and then come under here, and then it would Velcro right up here so that it helps hold it in place. There's also Velcro on the arm to be able to tuck it in and put that Velcro through to the other side there. It can feel a little awkward. Once it gets filled up with water and you get used to it, it'll really start to lay next to your skin nicely. Otherwise, you want to try to use this as much as you can. Follow the directions in the handout. If this is really just too bulky for you, use an ice pack that maybe feels more comfortable to you. Okay? Okay. All right, so that kind of takes care of the sling, dressing, ice. Now you just gotta wait and feel better.
Sounds good.
All right.